You may have been told that a biopsy needs to be performed. This means taking a sample of tissue. This usually happens at the very beginning of treatment, because through this, the doctors find out exactly what kind of changes are present in the tissue. This is a reliable way to find out whether it is actually cancer and what type of cancer it is. Sometimes, however, a biopsy is also necessary later on, either during or after treatment. Okay, so now we'll take it step by step. If doctors suspect that there is a disease somewhere in the body, they can take a very small sample from that exact spot and examine it closely in the lab. This happens, for example, when something unusual is discovered during a physical examination or shown on an X-ray, and you simply want to know what it is. That can, for instance, be a small lump somewhere on or in the body from which such a sample is taken. Doctors, of course, don't call it a lump, but rather, for example, a mass or lesion. And depending on where this mass is located, they will use different methods to take the sample. And now, let's go through these methods together. So there are various methods, and of course, they also have different names. First, let's talk about the puncture. In this procedure, the tissue sample is taken using a small needle that is hollow inside. It looks something like this. If you take a ballpoint pen or any kind of pen, and if you unscrew it here and take it out like this, you'll see that it's hollow at the back. You can basically see right through it. And it's basically the same principle. So it's kind of like the needle, you know, from blood draws, just a bit thicker. To help the doctors see exactly where in the body the sample is being taken from, images are sometimes taken at the same time during the operation, for example, with an ultrasound device. But often, as in the case of a bone marrow biopsy, you don't even need that because you can already feel the bone very well from the outside with your hands. Children and adolescents are carefully prepared for the biopsy, and of course, care is taken to make sure that everything is as stress-free and comfortable as possible. In cases of leukemia and lymphoma, bone marrow from the pelvis and often also cerebrospinal fluid from the spine must be punctured for diagnosis. So once here at the pelvis, yes, or also at the back for the spinal fluid. So that is also considered a puncture, but it is normally not a surgery performed or carried out by a surgeon. Most of the time, this actually takes place in the pediatric oncology department. Discuss with your doctors whether your child, for example, can receive medication for a light twilight sleep during the procedure. Medically, this is called sedation. In some cases, a full anesthesia might even be recommended. The next type of tissue sampling is the so-called keyhole surgery and endoscopy. A keyhole surgery uses a minimally invasive method called endoscopy, because sometimes you need to take a sample from a spot inside the body that is much deeper, much further in, and which you can't easily reach from the outside. That means often with endoscopy, you can actually see further into the depths of the body to find out what's really going on there. Endoscopy literally means looking inside. Of course, there are different types here as well, so subtypes of endoscopy, depending on whether the doctor wants to look into the chest cavity, the abdominal cavity, the stomach, or even into the cavities of the brain. So these are all different types of endoscopy. The actual procedure is therefore also called keyhole surgery, because with a very thin and fine instrument or several instruments, you can peer through those instruments as if through a keyhole in order to look deep into the cavity. So you really do look through it as through a keyhole, and it allows the surgeon to look far inside the body and take a tissue sample at the same time. This is definitely done under anesthesia, so your child or you as a teenager won't notice anything at all. With a modern endoscopy, it is even possible to perform an entire operation. Not just taking a sample, but actually performing surgery. Now, another method is called open biopsy. That's done whenever the most effective and safest way to reach the important spot is with an incision through the skin. An incision through the skin looks like this. No longer the little tube, like in a ballpoint pen, but this is actually done with a scalpel. And of course, this incision is kept as small as possible. Yes, sometimes you can even remove the entire tumor during this procedure. You just have better access that way. But I'll explain that to you in more detail in another video. Often, though, only a very small sample is taken at first, and that is then examined accordingly. Of course, the question is, are there any side effects? When you take a tissue sample, of course, it's possible that you might accidentally injure some of the surrounding tissue. Or it can also happen that there is heavier bleeding or that an infection occurs. So these are complications that can happen with any surgical procedure. But in general, this rarely happens in the course of a biopsy. And, reassuringly, such complications are almost always easy to manage. So we've covered quite a lot on this topic now, and now you know a great deal about biopsies. Sometimes it helps if you just watch the video again and then write down your questions. A list with your questions can be very helpful. So bring this list to your next appointment to go through all your questions together with your surgeon.